So today we're going to be talking about autism in the healthcare professional. What do you do if you are a healthcare professional and you find out that your next patient has autism? My name is Amy Perry and I am an autism resource specialist with the Autism Society of North Carolina. I am also the mother of a 23-year-old daughter who has severe autism. So today I look forward to teaching you some things about autism and hopefully providing you with some strategies and tips that can help you have more successful interactions with your patients. Let's do a little bit of Autism 101. Autism spectrum disorder is the second most common developmental disability following intellectual disability. Autism spectrum disorder is more common than childhood cancer, cystic fibrosis, and multiple sclerosis combined. It's estimated that 1 out of every 68 children born today have some form of autism spectrum disorder. Evidence suggests that the prevalence rate in North Carolina is even higher than the national average, and that number would be 1 in 59. The overall incidence of autism is consistent around the globe, and it is 5 times more common in boys than in girls. And you remember, right, I do have a daughter with autism, and that is much less common. I don't meet as many mothers of girls than I do of boys. Autism spectrum disorder knows no racial, ethnic, or social boundaries. Family income, lifestyle, education levels do not affect the chance of occurrence. This can happen to anyone, to any family. When autism spectrum disorder is typically diagnosed in children, while it is typically diagnosed in children, it is a lifelong disorder that affects individuals at all ages. So what is autism? So the core of the autism criteria looks at persistent deficits in social communication and social interaction across multiple contexts. The other thing it looks at is restrictive and repetitive patterns of behavior, interest, or activities. But autism is a spectrum disorder. We have a little saying at the Autism Society, and that's that if you've met one person with autism, you've met one person with autism. So let's talk about what a spectrum disorder really looks like. This meme is nice because it shows some people in history who may have had autism spectrum disorder. It didn't occur as a diagnosis until the early 1940s, but people with autism surely existed before that time. And so looking back in history, we speculate that people like Beethoven or Mark Twain or Charles Darwin or Mozart or Van Gogh, these are people based on what we know historically about their personality and characteristics and behaviors may have been diagnosed with autism had we known it at that time. So the condition has existed through the ages, simply under different terminology. We talk about autism, and even in diagnosing it, the diagnostic criteria lists a level 1, 2, or 3, whether the individual requires mild support, more support, or significant level of support. But autism isn't actually high, medium, and low, even though that's part of how the diagnosis works. It's not linear. So I will show you a series of graphics that I feel like explain how it is a spectrum disorder more clearly. So I love this graphic because it breaks down the areas that autism commonly impacts: verbal communication, nonverbal communication, social awareness, sensory integration, cognition, and adaptability. And I like to look at this graphic and say, so what's normal? If normal existed, it might be this slide where somebody is perfectly developed in all of these areas. I think we know that that actually would be abnormal for somebody to be perfectly balanced and perfectly skilled. That doesn't actually exist. This is often how the autism is portrayed in the media. I call this the Rain Man model, where you have someone who has a superior intelligence but has deficits in all of the other areas. This is more likely to be something like savant syndrome. This is not characteristic of autism. Not everyone with autism is a super genius, just like not everyone in the general population is a super genius. IQ is certainly something that's variable across the spectrum as well as across all humans. So I like to pose a little question with this slide, these next 2 slides, saying, is this person high functioning or low functioning? It's more of a rhetorical question, and there's not a concrete answer. But let's look at the features of this person. They may have very low verbal communication, but they actually have excellent nonverbal communication. They have other ways to communicate what they want or don't want or what they need. They may have actually fairly good social awareness, but they have a lot of sensory issues. So they may have a lot of atypical behaviors in terms of walking on their toes, flapping their hands, squealing, fixations with objects, things like that. In this model, this person may have above average intelligence, but they have problems with adaptability. They're going to have a really hard time when things don't go the way they expect. They're going to really want a lot of routine, and they may have a very hard time when that perception of how things should go becomes disrupted. So we look at this other model and we say, is this person high functioning or low functioning? So when we have a high level of verbal communication, normal verbal communication, and also normal or typical nonverbal communication, but the deficit for this hypothetical person is in social awareness. And I think it's important to pose the question, if we've got somebody who can talk, when we look at, as we experience our fellow humans in society, when someone makes a social error, like cutting in front of you in line, what are the thoughts that we have when someone makes a social error? It's common that we might think, oh, that was rude, or they don't have any manners, or something like that. And we don't often think, oh, this person has a social skills deficit, I wonder if they have a disability. So this is an important thing where people who have what we may term as higher functioning autism may struggle with common social rules and expected behaviors. In this model, this person does not have a lot of sensory issues, and they have above average intelligence, but they also have poor adaptability. They may not do well with changes in routine. They may have expected things. I sometimes think of this as the Big Bang Theory Sheldon Cooper model in many respects. And we all see that regardless of how intelligent Sheldon is, he's still impacted in many ways. So autism looks different in different people, and I love looking at it this way because it's easy to see how different people are going to be at different places, literally on that spectrum in terms of their skills and where their challenges are. So let's talk about some characteristics of autism. People with autism may have inappropriate social responses. They may have no fear or awareness of danger, They may appear to be insensitive to pain. They may be difficult to soothe. They may have repetitive play or vocalization. They may avoid eye contact, prefer to be alone, difficulty expressing their needs, appropriate attachments to objects, insistence or sameness in routine, spinning objects, flapping their hands, walking on their toes, and those kinds of things. One thing that comes to mind is my daughter with autism, when she becomes upset, she does not like to be touched, she doesn't like to be soothed, she doesn't like to talk to. So sometimes I found myself in situations where we're in public or we're even in a medical office and she is in a corner of the room, maybe sitting and screaming. She might be biting herself, she may be doing those things, and I have learned through experience and through coaching that when she exhibits those behaviors, I have to ignore them. And that can be alarming to some people because normally for a parent would comfort their child when they're upset, but it's actually more distressing for my daughter for anyone to interact with her in any way, just regardless of the good intentions. It's very hard, and we've learned that she has to be, sort of left to work through it herself. And so it's almost the opposite of the mother's intuition, that what helps her calm down is for me to do nothing. So that's one of the challenging things in being a mother of a child with autism. It's very different. I have two other children who are neurotypical, and it's completely the opposite of me. If they're upset, they want mom. But with autism, it becomes more challenging. So keep those kinds of things in mind as you experience families and patients with autism. So let's talk about autism symptoms and how they relate to other medical issues. So when we look at the overall symptoms of autism, like language impairment, social deficits, repetitive behaviors, there can be overlapping conditions. And again, this is one of the things that can make autism look different in different people. It's not uncommon that there are problems and deficits with sleep, mood disorders, anxiety, hyperactivity, attention deficit, those kinds of things all overlap autism, but they don't affect everyone with autism. My daughter does not have sleep problems, very fortunately, and she does not have ADHD, despite the fact that there are many other families that I know that those are some of the most challenging symptoms for their child's autism. So keep in mind that these other behaviors often, or health conditions, often overlap autism and can complicate things significantly for families. So let's talk about when autism goes to the doctor and what that experience can be like really on both sides. When I teach people about autism, I like to think of it through the filter of the sensory system. And if you think about our sensory system as being like the equalizer on a stereo, where sight, touch, hearing, taste, smell, all of those things are, the dials have been screwed with. Like if we're talking about that equalizer, for people with autism, it's not uncommon that either too much information is coming in some sensory areas and not enough sensory information may come in other areas. And this can drive and shape the behavior of a person. For some people with autism, they have a difficult time if there's too many things in the room to look at, if the room is too overcrowded, lots of things on the wall, decorations, things like that. Other people need to touch everything, or they're super sensitive to touch. They don't want to touch anything, or another person may need to touch everything in order to feel regulated. Your hearing can be out of focus in the same way that your eyes can be out of focus. So sometimes people with autism are more sensitive to sounds, and even sounds. My daughter is sensitive to sounds that we often can't hear. And so that's a challenge. She's also incredibly sensitive to smells, and doctors' offices that may have used a lot of chemicals or with the best intentions are using air fresheners and things like that. Those are very distracting and upsetting to her because she seems to smell them so much more strongly than a neurotypical person would. We kind of joke in our house that you could hide a bag of cookies anywhere in the house and she would be able to sniff them out like a bloodhound, and she's proven that to be true many, many times. So the people with autism are often having a very different sensory experience than the rest of us are, and that's going to impact the way they experience a medical environment as well. So let's talk, looking through the sensory channels, how a medical environment may be experienced differently for a person with autism. First of all, in a medical environment, we're looking at very different furniture. I don't know anybody who has a chair that looks like this in their house. That's very, very different. And if you're someone with autism, this may look very strange and foreign to you. And that may be alarming. In fact, there's even something over the head. That's odd. My daughter now will just step on a scale without any trouble, but we have a very difficult time getting her height because she won't allow the bar to come down over her head, even though it's not something that's going to hurt her. She's just very defensive about her head, and we can't lower the standard bar to measure her height. So there's a lot of different things that we see and that we experience within just a regular office visit, whether dentist or doctor or emergency room or those kinds of things. There's a lot of information, a lot of different unfamiliar objects, and what do they do, and are any of those things going to hurt me or make a noise or do something that I find to be upsetting or unpleasant. Touch is another very important sense, and especially in a medical environment, you're being touched with a lot of unfamiliar objects. Somebody's wearing gloves, or they look like they have blue hands. That can be very unsettling to some people, to be touched with something different. I remember my daughter with the pulse oximeter. She had a really hard time with that because they would pinch it open to put it on the finger, and it looked like something that it was going to bite her. And one day a nurse gave it to me and let me handle it, let my daughter handle it and show it, and she eventually was happy to put it on her finger. But it took a lot of time for her to become familiar with it and what it did, and also to see me handle it and touch it in order for her to feel like it would be safe. She wasn't just willing to accept that somebody touched her with something that was unfamiliar. Again, blood pressure, that squeezes your arm. That can be an uncomfortable and unfamiliar sensation, and what's it going to do? Some people with autism can speak and they can ask questions, and sometimes they can't. So just think about how the level of understanding for what these things do, or the way the sensory system experiences these, may be very, very different for that person. Even something as standing on a scale. When my daughter was maybe 2 years old, we had to make an emergency room visit for something, and we were in the triage room and they were attempting to do the vitals, and at one point my daughter began to scream so loud that several different doctors came running. And in the emergency room environment, that's not terribly common. There's often screaming in the emergency room, but they all came running to see why this young child was screaming, because it sounded like something was very wrong. And they were a little bit perplexed when they stuck their head into the exam room and they saw that what we were trying to do was to get her to stand on the scale. That was incredibly upsetting to her, and she was upset enough that it brought doctors running. So for her experience, she didn't know what this strange platform was and what was happening. Her anxiety level was very, very high. So even something that we say, there's nothing dangerous, there's nothing difficult about standing on a scale. The scale, for her, the unfamiliar was enough to make her feel like that might not be safe. So we did get her calmed down and she was okay. But that was one of those things where I realized I don't have to worry about needles, I have to worry about the unfamiliar, period, because that's going to upset her. Hearing is another very common thing. There are a lot of things in the medical world that make a lot of noises. For my daughter in particular, when she was very young, we went through an exam in which we were looking at her ears very closely, and it took several adults to hold down a 2-year-old to be able to look in her ears, and to this day nobody's been able to look in her ears again. I don't question the doctor who made the decision to do that. I felt like it was medically necessary at that point in time, but nobody will ever be able to go near her ears again. And so I've learned to be very careful what experiences we go through, because we may, if she has a bad experience, it may make it very difficult for us to do other procedures or examinations on her, or to even seek medical care in the future. I've learned to protect her medical experiences as much as I can and to keep them as positive as possible, because she has a phenomenal memory. And if she has a bad experience with something, to this day, if a doctor picks up an otoscope, it's going to be a problem if she thinks they're coming for her ears. So that's something that fortunately our doctor has been able to skip with us. So let's talk about taste. Again, there's a lot of different flavors that go along with the medical environment or even the dental environment. Those kinds of things. Even the wooden tongue depressor that goes in the mouth can have a much more significant or intense flavor than we might expect from just being a neurotypical person. Or medicines having flavor. Sometimes children have a very difficult time taking medicine in any form. It's not just about it being cherry flavored. It's a very strange thing to drink liquid off of a spoon. That's very unfamiliar. So these are often challenges that we as parents deal with, because sure, sometimes our kids need medicine, but getting it into them, it's not a matter of compliance. Those medical, the flavors and the tastes and those kinds of things are definitely a factor. Sensitivity to the teeth, going to the dentist, putting sharp things in the mouth, all of that are also incredibly difficult things to happen. So anyway, we've had to be careful with looking at the experiences that she goes through and making sure that we're aware of how she maybe experiences both the examination and the treatment. Smell, again, for my child in particular, is a very strong thing. So be aware of chemicals and scents that are used in the environment. Even if it seems to be a pleasant scent, someone with autism may be experiencing it more intensely than a neurotypical patient might. So just be aware of those kinds of things and smells in the environment. My daughter's much more likely to become agitated if there are a lot of perfumes or smells in the environment. So now you know a little bit more about autism and what your patient may be experiencing. So what can you do to help? What are some things you can do to help your patient get through the exam and still stay happy at the end? One of the things is understanding that you may need to schedule extra time for their appointments. Allowing parents to schedule an appointment either at the beginning of the day when the office is quiet, or at the end of the day, or a period of time when you're not as busy can be very helpful. Listen to the parent, to say the least. They know their child best. And I have always been very appreciative when going to the doctor and they go to try to do something like take my daughter's blood pressure, and I say, could we please skip that? Because if she becomes upset over the blood pressure, we may have a very difficult time doing anything else with her later. So please listen to the parents. We're not trying to be difficult. We are usually trying to ensure that our child has a successful experience with you. You take time to answer questions. There's a lot of different things that impact our children with autism that make it more complicated. So we may have more questions than the average parent does because there's so many different factors that we have to consider with our kids. And we would encourage you to value each family's role as an equal partner. We appreciate you helping us to take care of our kids, and we want what's best for them as well, and we value and we need your knowledge. And prioritizing the next steps for the family, helping them understand what treatment things may be optional, what things may be mandatory, where there could be some wiggle room, or what to do if something isn't working, coming back to get more help, because again, they may encounter challenges you wouldn't expect in a typical patient. Autism may make that much more difficult. Other things you can do to help: encourage communication between all family members, focusing and building on the positives that each child and family possesses. Let families know it's okay to not have all the answers today. Sometimes things are an investigative process and it takes time to get to know and to understand. Encouraging self-care. Parents of children with autism and caregivers of children with autism live through an awful lot of stress. It's a very challenging thing. So please understand that sometimes you have parents who don't get very much sleep because their children don't sleep very much, and they live with high levels of stress. And taking your child to an unfamiliar environment like a doctor's office can be also very, very stressful for them as well. So anyway, and try to just end each visit on a positive note. Find out what the child likes, what the child doesn't like, and those kinds of things. They have learned if they have to do a finger prick for my daughter at her doctor's office, we need to give 20 or 30 minutes for the finger prick. And for her, we've learned that we have to have 2 nurses try that at the same time. Each one takes a hand. And my daughter, fortunately, she thinks of it as a game for the most part. And one nurse just ultimately has to be quicker than the other one to get the drop of blood. We're not going to get more than a drop. But I've appreciated when they've been willing to take the extra time and even the extra personnel to make sure that she stays happy and to treat it like a game with her until eventually one nurse is faster than the other one. So things that might be simple and should be simple may often take more time for a child with autism. Preparing our kids ahead of time about what to expect is a very important tool, and we try to teach this to families as well. Letting them see the office area or what the exam room looks like ahead of time. I've sometimes gone and said, can I take a picture? So I can show her where we're going. I can show her what the room looks like. It's so much easier if she sees, and then once we're there, it's familiar to her. There are, sometimes parents will create social stories or social narratives helping them understand what's going to happen when they go to the dentist or when they go to the doctor, and talking them through that. When my daughter was young, when her older sister went to the dentist, I asked to be able to take some pictures of her visit to the dentist, and then we made a social narrative from that so that she would see what the room looked like and what the tools looked like. And it was definitely more helpful when she was able to go to the dentist because they allowed me to take the pictures to prepare her sister. So that was a helpful thing. Sometimes even videos of a procedure or something that's going to happen. Some children do benefit from knowing exactly what to expect. That can be calming to them. So it's very important to assume that the person understands what's being said, even if they're nonverbal. And this is a key thing because my daughter is nonverbal, but she pretty much understands almost everything that is said, whether she reacts to it or not. She understands what's being talked about, and so I'm always trying to be mindful of how I speak about her, or speak as if I'm speaking for her. And I'll say, Haven feels uncomfortable with this. Haven does better when this happens. I also will often ask her permission to say, is it all right if I talk to the doctor? She's often becomes less agitated if I've asked her permission to talk about her first. So keep those kinds of things in mind. Asking the parent or caregiver what would help. I I was incredibly grateful when a nurse one time allowed me to do the vitals. Essentially, they said, here's the thermometer. Well, she put it under her arm. And so because I was able to do those things with her, I started asking to do it ever since then because it went so well and she was so much more comfortable if I was holding the thermometer, if I let her touch the thermometer, once she was familiar with it. But a strange person coming at her with a strange object, that's kind of almost an automatic no for her. So that's one of the key pieces that that's helpful, is just ask the parent, is there something that would help make this easier for you or for your child? So strategies to support patients with autism, to recap, would be receptive communication, ration your words and use concrete and direct language, especially when you're talking to the patient. Using pictures or written words to represent the steps or show clear and finished parts of the procedure can be very, very helpful to them to know it's not going to go on forever. Arranging something desirable at the end. At the end, we'll get a treat or a sticker, or we'll get to go and do something that you like to do. So expressive communication, using communication boards, using picture cards, using pain scales. These are all things that can be very helpful to both families and patients with autism when you're interacting with them. This is just an example of what a pain scale looks like, whether it's 0 to 10 or 1 to 5 or something like that, using faces. Those are things that are very helpful for people with autism to be able to communicate how they may be feeling. It's a very powerful thing to say, I'm feeling very, very bad. And it's quite satisfying to know when you change that and they're feeling better later on. That's a very important thing. So people with autism often process visuals better than words, and this is sort of the core of what we help to support people with autism and their families, is understanding how beneficial that that visual supports can be. Picture schedules and social stories may be used by some families to support their child through the new experiences. We were in a medical setting recently. We had a family member having their wisdom teeth pulled, and my daughter with autism was with us that day. And she became agitated, and I realized, oh, I haven't prepared her for what we're going to do. And so I quickly, on my phone, typed up a little list of what we were doing, that we were waiting, that we were going to have a snack, and then that when we were going to go home. And she took the list from me, and then she typed that we were also going to go to her favorite restaurant. So anyway, I thought that was funny, but it also helped her to see that the way the day would progress, and she reminded me, I want something positive at the end, and sure enough, she did get the treat that she wanted once it was all said and done. So visual supports help people to understand. I could have told her again and again, we're waiting, we're getting a snack, when he's done, we'll go home, but she needed to see it, and that helped her understand it on a completely different level. First then, especially for young children or for people who are more impacted, is also a super helpful way to say, first we'll feel a pinch, then maybe later we'll play with cars. So that's something you may see families who come to visit you use, hopefully, but if not, even using first then visuals is a very simple way of helping them to understand what needs to happen right now, and then what will happen next after that. So this is an example of another type of visual for teaching the steps for brushing your teeth. And this is something that you could put up next to your sink at a dentist office, or give an example of it to the patient. It's often that a dentist will give free toothbrush and dental floss and those kinds of things, but reviewing the steps and pairing a visual with the steps in terms of how to brush your teeth, where to brush your teeth, and there's a lot of different variations of visual supports like this, but these are things that are helpful. They can be in drawings like this. A visual support can also be done with pictures that you take or that the family takes. So these are things that can be very helpful in teaching even people with higher functioning autism. It still helps them to see the steps and to know that they are doing them correctly. So This is something that is very helpful to people on the autism spectrum to see the order that things should go in. So let's talk about some do's and don'ts with autism. First and foremost, I would encourage you to say this won't hurt if it's possible that it will hurt. That trust between the doctor and the patient and the parent and the child is a very important thing. So don't say this won't hurt if it will hurt. You could say this will hurt, but it will be, tell me if it's a big hurt or a little hurt, right? So then we've distracted a little bit. Explain what's happening if that's possible. Avoid words like scared or worried. It's better to say, I can see that you're trying to be brave, other than say, I know you're scared. That puts the focus in a place where we don't want it. So keeping it positive, focusing on what they are doing well can be a very patient thing. Allow breaks if they need a break. Sometimes you just need to give them some time to calm down, and then maybe you can come back and revisit it. So when possible, give choices. Would you like to stand on the scale or take your temperature first? My daughter sometimes does well in making choices between two things that are very similar. Would you like me to write with this pen or with this pen? Or would you like this tongue depressor or this tongue depressor? Even if they're identical items, simply being able and allowed to make a choice about something that's happening or how something is happening. Would you like me to examine you on the table or sitting in mom's lap or sitting on the chair? Be aware that there can even be sensory concerns like with the crinkly paper that's on the table. We don't normally sit on paper except at the doctor's office, and a person with autism isn't likely to understand the reason for that. So find out if the paper on the table may be a problem. Maybe you can cover it with a sheet or something instead if that's something that becomes a barrier for the person being able to participate in their exam. Be prepared with distractions. I think that's one of my #1 mom tricks, is having a few tricks up my sleeve, but it's great when doctors have creativity and distractions that they can bring to help the patient along and to stop them from focusing on the fear. And ultimately, you want to go with what works. Sometimes we've done exams in creative ways in creative places. I had an eye doctor who came and he started the exam in the car. He sat in the back seat of our van with my daughter and got her comfortable with him, and then promised to show her something that she would enjoy in the office, and she was willing to follow him in. But previously, she wouldn't leave the car with me. So he came to her and was able to do part of the exam in that setting. So that was something that I really appreciated, that they were willing to take that into account. I would encourage you to remember that autism is only part of who someone is. Our kids are incredibly diverse, wonderful people, and it's only part of who they are. My daughter is first and foremost a child, although she is now a young woman, and I am first and foremost a person. So please remember that this is a person with autism. They are not a disorder. They are a person who is living with autism. And autism makes things incredibly challenging for not only the individual, but for the people who love and support them. So let's talk about resources and things that can help. We have developed an Autism Health Toolkit. It's available for free to download from our website. It's designed for parents to help them organize health information about their child or their family member with autism, how to share information with healthcare professionals, and preparing for appointments, benefits of a medical home. All of those things are shared in this toolkit. So parents or doctors can download this for free on our website. There are other guides that we have available. Hands in Autism is a great site, and they have some guides related to dental care, dental visits, strategies that help an individual with autism be more successful and more comfortable with dental visits. So I encourage you to check those out as well. These are other examples that we can show you about visual schedules, helping people with autism get through a difficult procedure or time, understanding the schedule of events, when they need to wait, when they will be receiving something that they want, if something is unpleasant, how long that will last, using timers. These are all things that can be very helpful for an individual with autism to get through a challenging experience. So the Autism Society has a team of autism resource specialists. We are all parents of children with autism, and we cover the entire state of North Carolina. We cover all 100 counties. We will connect you with resources. We will train you, we'll train families to become their child's best advocate. We provide guidance to navigate early intervention, school services, community and adult services, so we help connect families to services for autism. We also educate professionals in the community like yourselves to help them better understand how to serve their patients or clients with autism. And we connect families with support groups as well. So whether you, your practice, or families that you serve, we are here to help you better connect to autism resources and live more successfully with autism. We have workshops that you can see on our website. We have recorded a large library of webinars, and there's a link that you can see on the screen to direct you to our autism resource specialist. There is a map, and you can select and find the person who serves your area. We have toolkits, not just on healthcare, but on IEPs and school-related services, accessing services in the community, therapies and things like that. And we also have an ongoing blog where we post even more information. So I encourage you and your families to check that out. Things that you can do to help would be attending workshops, webinars, or conferences. We have an annual conference on autism every year. That's on our website. We appreciate when people volunteer at our events. Donations are always appreciated to help support parents and family advocacy. We have social recreation programs and camps for individuals with autism. We provide employment supports to help people with autism become successfully employed in their communities. We do trainings and consultations, both in the family and professional communities. We do skill building instruction, and we also provide legislative advocacy to help create laws and policies that will benefit and support people with autism. So, thank you very much for listening, and I hope to see you at another webinar soon.